A child hereditary is determined at the time of. The correct answer is option C, conception. Conception is the process in which sperm fertilizes an egg to start pregnancy. Neural tube or nervous system develops from. The correct answer is option A, ectoderm. Ectoderm is the outer layer that develops skin and nervous system of fetus, and endoderm is the inner layer that forms bones, heart and blood vessels. Mesoderm is middle layer that forms digestive system and respiratory system. Closure of neural tube begins at. The correct answer is option A. Cervical is the neck portion of backbone made up of 7 vertebrae. The closure of neural tube begins in the cervical area in the middle of embryo and extends from there in both the cranial and caudal direction. The heart is developed from. The correct answer is option C. Planchopluric intra-embryonic mesoderm. It is a part of intra-embryonic mesoderm that forms the heart, blood vessels and smooth muscles. The next question. Rectum develops from. The correct answer is cloaca. It is a common cavity in the embryo where the urinary system, digestive system, respiratory system opens. The next question. Small intestine develops from. The correct answer is midgut. Midgut is the middle part of embryonic digestive tract that forms most of the small intestine and parts of large intestine. Coronary sinus develops from. The correct answer is sinus venosus. Coronary sinus develops from. The correct answer is option C, sinus venosus. Coronary sinus is a large vein that collects blood from the heart muscle and drains into right atrium. The sinus venosus is the embryonic part of heart that receives venous blood and later contributes to right atrium. Fetus develops its own blood supply from dash week. The correct answer is option D, 12 to 28th week. Daughter cells formed after meiosis 1 contain dash chromosome. The correct answer is option D, haploid. The meiosis is a division in which homologous chromosomes separate, reducing the chromosome number to half. The haploid is nothing but a cell that contains one set of chromosomes. Then which of the periods of gestation is the most susceptible period for congenital malformation? The correct answer is option C, 3rd week to 8th week is the period of gestation most susceptible period for congenital malformation. The next are the physiochemical changes that occur in the sperm to make it capable of fertilizing the ovum is known as. The correct answer is option C, capacitation. Fetus formed from morula, blastocyst, inner cell mass, syncytial trophoblast. The correct answer is option C, inner cell mass. At what week embryo can differentiate as human? The correct answer is option D, 8th week. The mean cardiac output of fetus at term is. The correct answer is 500 ml per kg per minute. First of all, fetal heart sounds can be assessed between. The correct answer is option B, between 8 10 weeks.